Jill, just to put on the record, do we have a quorum?
Yes, you do.
Wonderful. All right. Good morning, everybody. Thanks so much for joining. You're at the March meeting of the Incarceration Prevention Reduction Task Force, and this is the Behavioral Health Committee. Welcome to everybody. Got a packed agenda, so I'll try to usher us through as best as I can today. I'm going to be your host today. Dan's got a good speaking part, so do my best to do that. Before we begin, I'll go ahead and read our land acknowledgement. Land acknowledgement. Before we begin, we acknowledge that we are gathered on the traditional and unceded territory of the Lummi, Nooksack, Samish, and Semiahmoo people who have cared for and tended this land since time immemorial. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. We begin this effort to acknowledge what has been buried by honoring the truth. We pay respect to their elders, past and present. Please take a moment to consider the many legacies of violence, displacement, migration, and settlement that bring us together here today. And please join us in uncovering such truths at any and all public events. Dan, do we want to do introductions? I think we all know each other.
I can't see the group, but if you're calm.
Okay, we can skip that. I think we all know each other. So we will go ahead and get started. So first up on the agenda, Byron's going to talk to us about treatment options for pregnant and parenting women. Byron?
And thank you, Mike. Recently, I think, as you know, I've talked to you through a little bit about the pregnant and parenting women population, about families that are served through women in their high-risk status. That I think I have sent out statistics around this group of population, which is 76% of the women have been in jail in the past. They have opiate use and women with past methamphetamine use also with a jail pass. So, 75 to 80 to 90% of these criminological behaviors and also substance abuse and mental health issues are prevalent in this group of women that we are working with and talking about serving. And so we do actually have a huge amount of data on this population too. And so we're kind of excited about the idea of what can we do to improve our ability to connect with these women through services and improve their service outcomes of what we already have. We have a lot of services that support them, but we're trying to figure out a better way to make them connected. And one of those things that have been missing in our community for a long time is availability of what we were considering inpatient treatment programs for pregnant and parenting women with children, so that they have a place that they can actually go through inpatient treatment and keep their children with them. And there is a program down south called Evergreen Recovery Centers, and they do a program, an inpatient treatment program for pregnant and parenting women. These are women who are pregnant or who have children up to the age of 3. They are and have used substance abuses during their pregnancy. And so they have a program, but it only has 16 beds. And we already have, like, when we were looking at our current programs serving these families, we have 20 moms that would be going down there to access that inpatient treatment program if it was available. And so we were looking at how can we expand those services and serve more families in Whatcom and in Skagit County, because we have programs that serve this population in both of those counties. So we decided, well, let's call up Linda Grant, who is the CEO of Evergreen Recovery Centers, and see if she'll come up and tell us, or see if she'll Zoom in with us and tell us about those programs. I decided to call Mike and Dan and see if you all would be, if they'd be interested in sitting in on a meeting with them to kind of learn more about what that is and whether or not that's something that really would help us with our incarceration prevention work here, as well as certainly just supporting women in these situations. And so it was great. We had a really long and good conversation with her. She really filled us in on, and I could probably sit and listen to her talk for another, couple of hours about what kinds of services and how to actually reach the women that she sees coming through with these circumstances. So it was a great conversation. And in that conversation, we were talking about, well, can we expand, the number of inpatient treatment beds that we might have? And she said, well, that's possible, but she said it's really a kind of a costly, very expensive kind of way to go, that they're coming up with and looking at alternative ways to provide that behavioral health services, both chemical or substance abuse disorder treatment services and mental health services for these moms while they're actually able to stay in a housing with their children in a supportive housing situation. And she brought up a program that's new. It's called Rising Strong, and it's run by Catholic Charities, Eastern Washington. And so she mentioned that that's just a really kind of innovative and great approach to bringing together multiple different resources that are already existing in order to create basically a similar but more maybe manageable behavioral health intervention that includes that housing component. So we're excited about that idea. And on, I think, Tuesday, the 23rd at 1 o'clock, we've got a meeting with Dawn Kinder, who is their director of the Rising Star program and vice president of stabilization services at Catholic Charities in Eastern Washington. So she'll be coming and talking to us about that program. So that's kind of where we're at. I know that Dan's scheduled to be at that meeting. I know, Mike, we've reached out, and I'm not sure if you were going to be able to be there. And Dan, you talked about maybe bringing on a couple of other folks to be on that call. Have you thought any more about that?
Yeah, so I'm very supportive of looking at these programs and moving forward with at least an examination. And I do think that we should have maybe someone with a little more clinical experience. Someone with clinical experience. I have none, so just someone with with that background would be helpful. I think just to cover that piece of it. We've got some folks on. Well, I think Britta Johnson's not here today, but I would hope that she would be able to attend, and perhaps Ann Deacon and maybe some others. Arlene, I know, has had the background in that. So I would welcome anyone who wants to attend that meeting to join us.
So are you recommending that I kind of put that meeting, I'll just send it the meeting when we get it scheduled to Jill, and then Jill can invite the group here. Would that be okay?
I think it's appropriate for anyone on this call today to be a part of that.
We will have clinical service providers there from Bridget Collins. On that call also were our Associate Executive Director and Clinical Director, Jen Lockwood, and Elizabeth Morgan, and our directors, Clinical Directors Elizabeth Morgan and Megan Brown were on that call as well. So they've got a wealth of knowledge of this service and these and mental health and behavioral health services for the community. So we will have at least that portion on there. And of course, Linda Grant's going to be on there. And so she's got that clinical background piece as well. So you'll get an earful, but it would be nice if somebody from here would be able to be that kind of liaison to that.
Byron, thanks for that. One of the things I wanted to bring up, I did attend that call, as Byron mentioned, with Linda Grant. And, we talked about how that might happen. As Byron mentioned, creating a brick and mortar residential treatment program is very costly and expensive. We can see the lift here in just making our drug court housing, our recovery house. It's many years in the making. I asked a question, and I see Mr. Thane over here in the corner. And one of my questions was, can models like this, can we support pregnant and parenting women who might be criminally justice involved? Can we keep them stable, but do it in scattered site? Does it have to be a dedicated thing? And Linda Grant's impression was she thought you could do things like that. I think that is an emerging practice, Byron. I don't know if I'm saying that correct. I think traditional models have really been very set aside, very apart, and part of the effectiveness of those treatment programs for pregnant and parenting women have been that piece. We talked about it, and not very far, but the idea of, well, could you use like project-based vouchers? Could you carve out a small program within a larger housing structure or something like that? So Brian, I don't know if you've ever heard of things like that in housing authority buildings. And if it wasn't in the building, maybe if there's any possibility of use of vouchers for such an idea. But I guess we tried to think of, is there some way that this could be lifted off for additional capacity in Whatcom County sooner? And using additional existing housing stock could be something that might help that. So I just thought I'd throw that out and see if you had ever heard of something like that.
No, I haven't, Mike. Just trying to think of the possibilities. We are close to our limit on vouchers that we can project base, but there is an expansion of vouchers coming with the Rescue Act. It's only temporary. So I don't know if we don't know yet the size, how many additional vouchers, and whether or not we can project base any of those. But we'll have more information before long.
Great, thanks.
Mike, this is Megan Ballou at Lummi. I've actually been wondering a very similar thing about using some of our funds in a way that could basically supplement other housing without having to create our whole new housing structure. So if this conversation continues in that direction, I'm definitely interested in looking at how we could do some partnering in that way to support tribal members and people in the Lummi community in that way.
Mm-hmm. I think thank you for that, Megan. And I don't know if it'll go beyond here. I think creativity is going to be key because we're going to have niche needs for housing, but we're limited in that housing stock and what we have available to us. So it sounds great in my head. I wish it could come in fruition faster. It's just, at Opportunity Council working in housing, this problem that Byron brought up that all of his staff are seeing and this unmet need has been going on for years. And I just want to underscore that briefly. I remember trying to get people into housing and people would want those services and that comfort of being able to have their child. And there was often no room at the end. It has been going on for 10 plus years. So go ahead, Byron. I'm sorry.
I was going to say, it was interesting. Linda Gratt talked a little bit about that too, kind of like, trying to even find housing or go through the systems. And she said, we just decided to go buy a house. They just went and bought a place and all the red tape just went out the door, so maybe that, well, no, I shouldn't, that's an exaggeration, but she said it really helped, with that kind of component. And so, I mean, that's also a possibility that we can look at our private community to help us maybe find something like that might be suitable for that purpose and not have to worry about those housing voucher pieces or in combination with that. So I think that's where that creativity that Mike is talking about, that that we have to think outside the box of how we normally do this work and make it happen. So. And then bring in resources, fill the gaps where they're not. So that's where I'm going. And you're right. This is all. We may be. I'm not trying to put the cart before the horse here, because I know this may or may not be something that really is suitable for our community, and we still got a long ways to go to look at that. So thanks for listening about it, and I hope you guys can attend on Tuesday.
Thanks for that, Byron. Stephen.
Byron, I'm interested in the numbers. Do you know, you've identified 20 people locally, 20 women. Would you estimate how many more there are? And does the Evergreen program have a waiting list? What's the service capacity for the Rising Strong program?
I don't. I know Evergreen's capacity is a 16-bed facility, and they serve, certainly all of Snohomish County. They get a few people from Skagit County. We don't get anybody, not much, from Whatcom County because there's not enough space. They also have, they get folks from other areas of the community as well. So in terms of that, in terms of how many could benefit from a similar type of a program in our community besides the 20 that's up in this area, just in one particular program. Skagit County is probably going to be about, from our program down there, maybe even a little bit higher due to some of the circumstances that they're in. County-wide, I think that we probably don't see everybody that might be, needing this because they leave our programs before, or something like that because they're not got enough support, and they go back to the families and the situations that they're in, and then they don't get the help they need. So I think I would say that I wouldn't try to go very big program here, though. This would be a small type of a thing. I would think we, want to, because it has to have some supports around it. There's parenting that goes along with it, and then there's intensive case management that goes around that, plus the unique and specific behavioral health interventions that are needed, which maybe, maybe their Medicaid will cover that component of it. The other component of it is parenting, and so we've got that covered for a portion of it. So, but if we were to look at a program of 12 or something like that, that'd be 12 apartments or 12 units that would hopefully be in a similar location, that could be supported through those sorts of things. So it is a program, and it will take some things to put it together.
Heather?
I would just be remiss if I didn't say that the Empire Health Foundation was a really significant partner in launching Rising Strong. I don't know if that came up in any of your discussions. And my sister-in-law used to be the vice president over there, Sarah Lyman, who was really involved in launching this program. And I will say that it is cost intensive as well, but it still achieves the savings on the downstream that we all care about, right? With keeping families together, keeping people out of the criminal justice system. But I know that Empire played a really significant role with investments. And if it's ever useful to invite Sarah to join us for a discussion or a small conversation about how philanthropy can be really helpful in unrestricted capital, I would be glad to invite her. And if you check out the Empire Health Foundation website, they have some great stats about the outcomes of this program. I actually had an opportunity to tour the facility in Spokane, and it's pretty remarkable being able to keep families together through those, through treatment, through those issues. The evidence shows is so much better in the long run than removing children from families. So I would be so supportive if we could try and have a program like this in Whatcom County. And thanks, Byron, for bringing it to our attention.
Absolutely. I guess my thinking would be, Heather, is that maybe after our meeting on Tuesday, that we talk about, kind of deciding whether this is a direction that we really want to go, kind of what the size might be and what we're looking for. And then we could talk about putting a budget together that might work. As I'm always a firm believer that to at least get 3 years worth of funding, secured before taking off on a big venture like this. So there might be a little bit of a heavy lift in that fashion, but I think it's probably pretty doable based on kind of my general thinking about how much that a budget for a program like this might take. So anyway, thanks for the additional piece. And I was just saying maybe we should go on a tour or something. I used to always love doing that. Go and visit other places with groups of people. So maybe at some point that might be of interest to do. So Spokane's a little far away though.
All right. Any other, Dan?
I just wanted to get Ann Deacon's opinion on this. I chatted with her briefly about this concept and just wanted to get a health department perspective on this idea if Ann's around on the call.
I'm around on the call. I always love all of these programs. And for us, the challenge is always the operational funding. And who are the funders? Do the funders think it's as important as we do? And who possibly could provide the funding for operational support? I think also for us right now, the biggest challenge is the workforce. We have lost significant clinical people in our community over the last 18, 24 months. So I just think when it's just something you have to include in your needs assessment. Do we have what we need to actually make it work? But obviously, I love these kind of programs. We know they work, and the more intense for people who have long histories of behaviors that get in their way, that intensive service is what is most effective.
I want to encourage you to dream big and to understand that this is absolutely core underpinning of everything that we're trying to do. The preventative work starts that, I mean, some of you are parents of little ones, and so you're experiencing directly exactly how influential you are from the minute that baby arrives, and how you're setting into place attitudes, trust, expectations right from the beginning. So it's pretty important. And I think there will be people who will want to support it. And it's just an important piece of the whole.
Arlene, you kind of brought us back to kind of a fitting in, which is kind of how this fits into this committee's work. How does this fit in our priorities? And this is squarely diving into both things that affects youth and prevention. And it's really kind of both, right? That a lot of women that we heard about that would avail themselves of these services have had previous criminal justice involvement, have had challenges in their lives. But for that little one, it's really preventative, right? And so there's two aspects of our continuum that we would be addressing with something like this. So Byron, I just really appreciate you bringing it up. I think it's squarely a type of intervention and very unique in that it's really getting somebody in different stages in their life and would be a very powerful asset, I think, in Whatcom. I think it's also one of those things that if people didn't have to travel, if it could be local, and that was really interesting for me too, is that it wasn't just that there might be treatment beds in Yakima. There have been treatment beds for singles, for example, in Yakima for a long time. The problem is that people go and get clean and sober somewhere else, and then they come home. And so ability to do that in our own communities would be huge. There's nothing else on this particular subject. I think we'll get an invite from Byron. Thanks for arranging that. Rising Strong looks to be a fascinating program, and I'm definitely going to try to attend. All right, so moving on to our next piece, and that is actually me. And before I get started on a little bit about racial equity in the GARE toolkit, I just want to let folks know I attended a GARE information session on membership with their membership director. These are free and available for anyone. And while it was not a webinar that was really going to teach us how to use it, it talked a lot about membership, how people use toolkit, sets of questions. How are they adopting and making this commitment to rooting out racial inequities? What is that looking like? And what is the support around that? So I don't know if that's still a going concern. And Heather, I see you on the call, and I wondered if before I talk a little bit about some of this committee's work and how I see it as kind of tied or a part of racial equity, I wondered if I could call on you and just to give us an update. You've been very helpful in past meetings, just talking about the movement in Whatcom County towards maybe a racial equity task force or membership. And I wondered if I might call on you briefly.
I'm happy to share a brief update. We have a really wonderful team of people working to develop a racial equity commission. Sue Lang Zhao and Christina Michelle have been the two leads on this, and the founders of the concept that came out of a really fun story of a listening session with prosecutor Eric Ritchie. And And at the same time, our government partners had some thoughts about doing something like this too, in response to the listening sessions that were hosted this summer after the really tragic killing of George Floyd. And there seems to be a community consensus, at least based on the 200 to 250 people that we've all talked to, that we need a commission that can address racial disparities and racial equity in Whatcom County. And we need a place for our marginalized populations, our impacted people, to come together with institutional leadership and work on solutions together. Because when we do them apart, they don't work, they don't last. The system just accidentally perpetuates systemic outcomes, which we're trying to transform and change for the better. And in Whatcom County, if you all probably know, we have serious disparities that we know of, and there's probably more that the data hasn't even showed us yet. We have disparities in how long people live. We have race-based disparities in income, in who's impacted by substance use disorder, by mental health issues, who shows up in our jail, who's showing up kindergarten ready, full, a belly full of food and ready to learn. So there are issues to address here. Status update, we were working with our county and city governments, realized that we actually need to go through an RFP process. And so that's where we're at right now. There's an open RFP, we'll be applying. It's a little bit awkward with the timing because we've been working on this for 6 months now, and now we have to apply. That I think, we're hopeful we'll be selected, and we're prepared to continue this work one way or another. And the goal is to have an ordinance in place, recommended to county council before the end of this year. We were hoping for summer, but everything takes so much longer than it needs to, or I mean, maybe it takes as long as it needs.
Did she freeze or? Oh.
Selection process. Sorry, I'm going on farther than I expected to. I'm just excited. So that's that.
No, please go on. Actually, you froze briefly and I was like, what are you saying? So you were not going on too long. I was excited, but I couldn't hear you for a moment there. But I think we got the gist. So the RFP to get an ordinance on the books is really is where that's key at. Heather, thank you for sharing that. One of the reasons why I wanted to bring that up is somebody asked a really good question when this group, the Incarceration Prevention Reduction Task Force, adopted GARE's toolkit. And it was kind of, well, how would that work? Well, if this other group is here, wouldn't they be handling it? And one of the things I got from sitting in the GARE membership session with a council member from Urbana, Illinois, and all kinds of different folks from government, mostly walks of life, were on this call. And one of the things that the membership director said is that one of the things we see in government and in criminal justice specifically is some of the smartest people on the planet, but they're also highly specialized and they're highly focused, and they have to be, because they have to be so good at what they do. And one of the things that racial equity work, in order for it to be successful, is having that representation across departments, across functions, and then joining. So I guess for me, that just kind of reified that we did a good thing by saying we're going to do our best to try to embody those principles, to use the principles of racial equity and those lenses in our reduction efforts. Because we have so many people from so many functional areas who are knowledge experts. I'm constantly blown away at how knowledge experts we are in areas. And then we get to racial equity and we're all students and we're all learning again. And that can be scary for some, and I get that. For me, it just gets me excited, just to roll up the sleeves. So Heather, please go ahead.
I think what you're saying, Mike, is that we all need to be committed to racial equity, and it's not duplicative. If the task force says we want a racial equity lens, GARE is a tool that we can use. And at the same time, if there's a commission being developed to address these issues, we need all of that. We need everybody to prioritize that. And my hope is that once the commission is established, that there can be partnerships and there can be mutual support, and advantages of having a body focused just on that, and then a body of content that is also looking through a lens. So I'm just supportive of what I think I'm hearing you say.
Spot on. Yes,
Okay.
thank you. And you said it better. So thank you for that. Jill, would you mind bringing up the agenda and the toolkit that is, so I believe it's in the packet, page 8, I believe, Jill? Jill is awesome. Look at that, like lickety split. I just want to reacquaint this group with the question sets. And I believe, Jill, maybe it's up. Sorry, I might have told you the wrong one. I'm looking at my PDF that you sent me earlier. There we go. Okay. Thank you, Jill. So just to reacquaint ourselves on this subcommittee of the racial equity tool, and this was talked about briefly. So if you were part of the committee of the whole, we did talk about this very briefly. And it's a little, and your co-chair and I have discussed, well, what makes sense for the behavioral health subcommittee at this juncture? Obviously, if we bring up specific proposals, if we make a recommendation, I think the toolkit, its list of questions can kind of make intuitive sense. But what if we're doing process work? And so one of the things that Dan and I discussed is by the co-chairs and you all looking at our makeup and who are we as people, what groups possibly can we represent or speak to, and where might we be missing representation? Because that's one of the key things. So number 3, right, community engagement. This group actually benefits from looking a lot like its community. And so part of our work with this is to look at who's at the table, who's not at the table. So we have been, that's why you see your numbers growing. Thank you to new members for joining the Behavioral Health Subcommittee. It's not just an action. We're not trying to pack a room. We really want that diversity of experience, of representation. And from you all, if you see areas, by the way, that this committee or our leadership can improve in that way, we're really open to that. We think we've got a really solid foundation, but can still grow. Another piece that Dan and I discussed about operationalizing racial equity in the work that we do, right? We're trying to reduce incarceration. And this has come up a couple of times. And what I'd like to just take the remaining minutes in this section of the agenda is to make that recommendation to index for those data elements we need. One of the key things about racial equity or any outcome, and you heard some statistics from Heather, that give you a sense of where the disparities are. Well, the only reason why Heather is able to give those to us is because we've been tracking information. And it's going to be really critical for us to be asking the right questions. We also know something from our law enforcement partners that information is not always uniform. The systems are disparate, don't talk, and they may sometimes be running counter to us. So I just wanted to kick that off briefly. It's been on our agenda once or twice, but we haven't come up with a firm recommendation. So I guess what I'm asking the committee is, what data elements do you think are going to be crucial for our system? And we can think very broadly about system. You can think specifically about a criminal justice program, or you can think very broadly, but what data elements are we going to need? And the one I started with was the one that the chief of our jail told us, Wendy Jones, that some of the federal programs don't actually track Hispanic or Latinx heritage. So I just want to kick that off briefly, get any thoughts on that. And if anybody has noticed any other holes in our data that we might want to recommend to index that we want to shore up.
I'll go, Mike.
Okay, Dan.
I think one key piece that we need to get our heads around is social determinants of health that lead to future criminogenic outcomes. It's kind of a heady thing, but I think that we need to get our handle on that.
All right, Stephen, I saw you unmute. Were you going to chime?
Yeah, my thinking goes toward the fact that a lot of our struggle is on the capacity end. You heard Ann talk about workforce limitations. And so I'd be interested in diversity data in behavioral health provider, the workforce. I'd be interested in, and I suspect this kind of data already exists across the board in behavioral health services. Arlene may know what the North Sound Administrative Services Organization, or Ann may know the Medicaid managed care plans, what service data they have broken down by racial and ethnic categories. So we can see whether we would need to address disparities in where we would be diverting people to, I guess is the short way of saying that.
To add on to that, if I may, one piece of data within the criminal justice system that I haven't seen yet, and I imagine exists, is just the booking data by jurisdiction. And I feel like that's the next question after when we talk about who's in our jail and we see there's differences by race and there's disparities by race. What's that next level of who's being arrested where? Because I think that helps us identify where there might be opportunities for implicit bias training, or it just helps us get a little more granular with our strategies. And then Stephen, to add on to yours a little bit, I think who's even being offered the services, who's being offered reentry support, and what are those long-term outcomes based on race?
Agreed.
Well, I mean, I think this is a real interesting conversation because, as we look at different toolkits and different means and ways that we address equity, either in incarceration and arrest and things of this nature, the real big elephant in the room is just this uncomfortableness of talking about race in itself, right? And, we tend to say, how can we do better? How can we take a deep dive at these things? But to Heather's point, if we're afraid in any community, whether it's the law enforcement community or the behavioral health community or any other community, if we are afraid to try to extract the data, right, we're never going to get where we want to go to take a look at this. So, I think we have to really say, okay, let's not be afraid. Let's see who we're helping. Let's see who we're arresting, when, and things of that nature. So I think, I don't know how we get there, but I think, we really just have to come together with this idea of we can't be afraid to, say who we're dealing with and who we're contacting. And I will tell you, because, I came to Bellingham in 2014, I do recall a time where I asked one of my officers at the agency I was at, I was like, well, what was the race of that person? And the officer says, well, I don't know, we don't ask that, and at that time, that's the way the officer was taught. And I think today that's still the same, because it could be offensive, right? But then yet in committees like this, we're asking for the data, yet some officers on the streets are being trained not to ask that. So, there is, an intersection here that's kind of butting heads that we need to figure out.
I mean, to me, this conversation points in a slightly other direction, which is to think about the Northwest culture. We have a culture here, and I'm sure that the chief has encountered that culture within the years that he's come to live here. And what I found when I first came was a separation of groupings. and sort of a fear and a reluctance to step over the separation into connection with other people. And it's subtle. It's a very passive, subtle set of behaviors. And I think the only antidote to it is to step out of it and reach your hand out to people that you meet, to make relationships and to get to know people. And this is not the style up here in general. It's just not. I mean, people here are kind, but they're cool and not overly willing to bring other people into their circle and into friendship with them. So I'm not sure if this is really the topic for this conversation, but I couldn't let it pass because it affects the way we act and the way we try to solve a problem like this. You have to get to know people and you have to reach out and make effort. You have to go into other groupings of people, attend their meetings, get to know those people. So I see this piece underneath the other problems that we're talking about.
Byron, I believe you.
Yeah, no, thanks so much for bringing up that point about getting the data out to kind of really show and about, just being, being okay to having enough courage to kind of just talk about race. We definitely don't have that. We don't have that experience up in this community. And so I really appreciate your bringing that up and bringing up this topic. And Heather, thanks for bringing up that need for that kind of data. Data really can help us learn where to target our interventions. So I'm really supportive of this idea. I do apologize. I've got another meeting I've got to go to. This is, anyway, I don't have a choice, but I need to go. So it's been great hanging out.
Thanks, Byron. Was there anybody else that wanted to chime in on that piece?
Yeah, I want to make sure that we're observing the outcomes of GRACE and LEAD and MCOT. I want to make sure that those are part of our discussion as we continue forward. Those are priority programs. The LEAD and GRACE are two additive new programs, and I want to make sure that we're collecting data. And I think it's fairly readily available, but those are two that I want to make sure that we're good, and as well as MCOT.
I think Megan is still with us, but I thought Stephen bringing up behavioral health data, I think I was looking at this a little too narrowly. And Stephen, thank you for bringing up. I really want to know those elements about people who may have severe behavioral health disorders as well. And that just kind of expanded that thinking. And obviously, because in our treatment continuum, that affects too. That's will put people in front of us who might be more or less likely to be arrested. So we've got some really good notes here. And Stephen, if you don't mind, if I might just quiz you briefly, being on steering and kind of the co-chair of our committee, what is process-wise, what is a good way for us to share just some of the collective wisdom that you got from these committee members about data elements? What's a good way to get that to Caleb and index? Should we draft something? Should it be more formal? Should it be a conversation? Should we share the minutes? What's your thought here?
That's a great question, Mike. I think that, well, I'll just share my observation is that we've been musing about these kinds of questions for several months now, since we actually formally adopted GARE. And so my sense would be it's time to sort of kick it into a very concrete stage. And the clarity required for that, to me, would come in some sort of written compilation of questions or data points that we want to track. Just bulleting them, and Dan added a couple just a moment ago, but there have been several building up to that. That would give Caleb something to take back to the committee. That would give them something to distribute amongst themselves. it would be uniform information that everybody there in that committee would have. They could take it back to their disparate systems. They could see if they could compare notes across systems. It would just be clearer and more workable to have a sort of a written list of the data we're interested in.
I have some information on that as well. The Index Committee, in cooperation with County IT, has created an email for specific index requests. That email is for the task force members themselves, not necessarily for the general public. So the purpose of that email then is to make formal requests of the Index Committee, and I can share that email with you, Mike and Dan, or all of you, so you have that information.
Thank
Thanks,
you,
Bill.
Bill. Yeah, I'd forgotten about that, and that's really helpful.
So I will do my best at kind of summing, and maybe Jill, maybe I can get together with you after the meeting just to kind of go through notes and make sure we've got points. I'm happy to do that. I'll share that with the committee. And then if you see something that was missing, we'll make sure that every committee member has the email and we can get that in. And Stephen, thank you for the observation. That's why I brought it up again. I was like, we got to get somewhere. And sometimes it feels like we're not able to really get somewhere in action. So thank you for the participation today. There's more ideas than we had before. It's extremely helpful. And like I said, it may feel kind of faltering, and it does to me a little bit, about when we operationalize racial equity. But I really appreciate the chief's words, is that we can't be afraid, and I can't be afraid of being foolish or not knowing what I'm doing, because that's kind of part of our deal is we're trying to do the best we can but make progress. I'm a pragmatist at heart, so I appreciate the charge. So I will take that on. I'll share that with the committee. Jill, is that okay to share that email that I would send to Index with the entire committee?
Yes, of course.
Okay, great. So I'll plan on doing that, and then other committee members, please feel free to either chime in on that email or add your own pieces.
Actually, I would say don't chime in, as we don't want to run afoul of the Open Public Meetings Act. If you want to send something to me only in response, and I can pass that information along, that would be fine.
Perfect.
I want to inadvertently start an email meeting.
Thank you, Jill, helping us navigate those tricky waters. Much appreciated. All right. If nothing else, then we'll go ahead and move to the next agenda item. And Jill, could I talk you into taking us off the deep dive into our racial equity tool? Okay. So next up on the agenda, if nothing else, we are on to 2021 committee priorities. Dan, I'll start it off with you, if that's all right.
Sure. I think there's a big elephant in the room that we need to address, and then I think this committee needs to understand what that is, and that's the Blake decision. Are you all familiar with that? Supreme Court ruling was a 4-1-4 ruling. Washington State Supreme Court ruled that basically simple possession is not going to be a charge. So VOXA, violation of Uniform Controlled Substance Use Act, is not really in play anymore. Because we deal with substance use disorder and mental health issues, this committee needs to figure out where its position is on that decision, and what the ramifications are for Whatcom County residents. Just a little bit of context for y'all. Prior to this, Prosecutor Ritchie took VOXA violations, simple possession violations, from a felony to a misdemeanor level. So that was already in play, but this is a complete game changer. And I think we need, I have personal opinions on decriminalization. I think people probably understand where I'm at with that. But if we don't do treatment, addiction treatment services along with decriminalizing, then we have one half of the whole. And we have to provide options for people who are ready and willing to go into treatment. That means treatment beds. It means services. We talked before about workforce capacity. That's definitely in play too. So I just want to make sure that you all have that on your radar screen, that is a real thing that that we're going to be dealing with. We had talked to be prior. I'm trying to memorialize some of these items. We had talked about substance use disorder, methamphetamine use as a priority, trying to figure out treatment options for that. We had talked about upstream prevention. I know that at least one of the callers on the call today is interested in a children's initiative, of which I am very interested in as well. And so I think that those, those upstream things are things that we've talked about as a committee and have prioritized and worked on. And then I'm just going to do a couple more comments here, and I'll stop talking. But I think that we need to look at the city council's recent decision on Monday to adopt 1590. So that's $3 million for housing and housing related services and mental health services as well. 60% of the $3 million needs to go to housing, and up to 40% can go to behavioral health services. Though that is absolutely germane to what we do in this group. We also, I think, need to consider the 1406, House Bill 1406 dollars, is about $700,000 per year that the county receives. I advocated for doing that countywide versus splitting it between the city and the county. It made more sense to me that way. And then EDI, economic development impact dollars, and then REIT, real estate excise tax dollars. Both of those funds can go towards certainly towards housing, for housing stability, but also I don't know, probably Andy probably knows more about this than I do, but perhaps those we can look at service dollars as well. And then I think that we need to revisit the 1/10 of 1% sales tax that was issued countywide back in, I think it was 2006, and just make sure that I want this group to have a better understanding. It's not to monitor or to maybe perhaps make recommendations, but that 1/10 of 1% sales tax countywide, I think it's about $5 million, or maybe it's 4.8. That goes towards the PETA, prevention, intervention, treatment, and aftercare model that the county has. And I want to make sure that this committee is just aware of what that looks like, so we can be fluent in when we're discussing these matters with our constituent groups, that we have some knowledge when it comes to that. I'm probably missing a handful of things here, but those are the things that I had taken notes on. Mike, I guess back to you.
That's a really good summary. And just really quick, just to underscore what Dan said, what essentially this agenda item is doing is capturing some of our previous discussions about what is the meat of the committee work this year? What are we looking at, right? So obviously in everything we're doing, we're seeking to employ racial equity toolkits, but what are the actual processes that we might weigh in on? What are the recommendations the committee might do? And obviously working with our other committees such as Index is going to be really crucial, making sure that we have the data, but also I think the committee can be useful when different niche issues are brought before it of that are at the nexus of behavioral health and criminal justice. We can learn about them, and we can weigh in or put kind of our vote of confidence behind promising practices or best practices. And so that's, I guess, why the 2021 committee priorities are on this agenda item. And I would just invite, if there were any other committee members that had something, we've heard from Chris, when you first joined our committee, it was great. You shared a lot about what the school district is doing and kind of how that overlay. You've been with us a couple of meetings now. Do you have any thoughts for us on a committee priority, maybe specifically vis-a-vis regarding youth or children? Or
I think, I still feel like my role is primarily just learning and listening to you all. I feel like the passion and wisdom, both of those things that you all are bringing to the table, it's really helpful for me in just learning about so many different areas. Each, like Donnell brought up, I think there's so many topics, whether it's being willing to look at race, being willing to look upstream at what are our families, our people of color in our community, what services are they already accessing, what's working for them. And then like for me, I live in Blaine, so Donal and I have that in common. And when I think about where our kids, because we in our family we have 3 kids that are Caucasian and 3 kids that are African American. And when I think about the areas where I see the most diversity in our small community in Blaine, I think about Boys and Girls Club. And I know that's a little bit removed from our conversation, but I just think about the ways that takes stress off our families in terms of, you know, being able to work and having that after school care. And so when each of the topics we bring up, I'm just kind of reflecting on what we could do as a school, like when Byron brought up the pregnant and parenting moms idea, thought I know our district would be very interested in, if we're looking at not a silo self-contained program, but one that's collaborative. I know we would be interested in how we can come around things like that. But I don't have any specifics around priorities as much as I do the collaboration of how can our district be proactive in being part of the solution and helping, and like so many of you said, and Tank said, how can we be really courageous and intentional about where we're looking? So I'm just eager to learn. And if you have any suggestions, I have to hop to a 10 o'clock meeting and I apologize, but yeah, any suggestions you have for me, I'd love to have conversations, just learning more. Thank you.
Thanks, Chris.
I mean, I just wanted to say one little thing about what you're talking about. That's that the teacher training is crucial for the influence of the children. The programs that you offer to the teachers about how they handle these topics and how they can spot family problems and difficulties coming up. To me, when I heard you talk about all the programs that you have, I was amazed, really, that we had so much in place, and I'm very grateful for that. But anything that we want to get to the children is through the public school system is going to come through the teachers and the administration and the counselors.
I appreciate you saying that. It's helpful to hear. You know, one of the things I'm really passionate about right now is we're doing quite a bit of exploration into trauma-informed work. And I know that's a buzzword in a lot of places, but you know, for me, I feel like trauma-informed work is an area of equity in that it starts with the brain. And so if we're training people like educators to look at, okay, so every time you work with this individual child, how are you addressing where they are emotionally and cognitively? And in some ways that can be a neutralizing factor in terms of, like when we think about school to prison pipeline and other ways that our institution is unintentionally or in the past maybe intentionally creating the system that's not working for all of our kids. I feel like trauma-informed work is one of those areas we can train our staff in that can reverse that and really create better outcomes for the kids who need it most. So that's one of those areas when you talk about training that I think is so key. Those type of models where it's really human-centric and it allows our staff to do their very best work based on what we know about brain development. And in essence, because of that, counteracts some of the inequitable outcomes we had based on race or socioeconomics. So I appreciate you letting me talk to that.
Thanks for that, Chris. Any other committee members on this particular item? Dan, did you have anything else? I think you gave us a pretty good summary, but.
Well, I think that we need to kind of figure out our process here in terms of what we're going to prioritize and discuss in our subsequent meetings this year. You know, I rattle off a number of different items, but you know, I don't want those to just go off into the vapor and be, you know, I want to actually settle on what are we going to talk about and where do we make decisions and what recommendations we will make to the broader task force and then to the county council. So I want to make sure that we have some forward, you know, some traction on that. And we do have a number of significant things that are happening when it comes to behavioral health within the community that we need to address. And so I also want to make sure that we do the GARE overlay on everything we're doing. And Mike, I'm looking to you for some guidance on that. And that includes when we're making decisions on priorities. I think GARE needs to be, that's got to be an overlay. It has to be, because that's like the basic essence of what we're working on. So I'm looking to the team here for some guidance and some help on what we should be prioritizing for the balance of the year.
Great.
Can I just
Stephen,
step
your
in
hand
for- Sorry, go ahead.
Okay. Stephen?
Two thoughts. I'm struck by Dan's listing of some of the funding sources we have available to us. And I keep going back to the fact that we run into capacity hurdles. And I know we can't change Medicaid eligibility. We can't budge the managed care plans too much, but I'm just wondering whether at some point soon, this group might be sort of a cauldron for creativity for expanding capacity locally somehow, whether it's supporting training at the local colleges, whether it's creating locally funded provisions. You know, we have the behavioral health access process with some public monies that funds behavioral health care for people. Whether there are some ways that we can somewhat ignore or take full advantage of, but not be limited by a pretty dysfunctional service delivery system, and create something more of our own. And I beyond that level of generality, we'd require a lot of expert input from Ann and her team and some others. But I just think that that's something for at least some of us to talk about, maybe just to generate ideas about where we might go with that. The second thought I have, and I'm almost embarrassed to say this on a public record that's being recorded, but I was struck by Chris's comment about trauma-informed care. And I realized that when I think about racial disparities, I think about people who just don't get a benefit that other people get. And that's the disparity. When in truth, the people who don't get that benefit suffer actual, concrete, profound harm. They are traumatized by that disparity. And so I would just say it would benefit me, at least, as we grapple with racial equity and racial disparity issues, if we weave in some trauma-informed kind of mutual training or mutual understanding, or that becomes a part of our conversation when we talk about addressing racial disparities.
I know that frequently, well, we obviously we have Ann, sometimes we've got Perry Mowry too from our health department who might be able to be helpful with that. But Ann, I see you unmuting, and obviously there was some talk about how the committee might be useful. Dan brought up some new funding sources, and at least I'm aware of some bodies already that are in place that do recommendations on some funding. And I wondered if you might just, like, Behavioral Health Revenue Advisory Committee used to be a thing. Is that still around? Could you maybe just very briefly, if you don't mind, share kind of some of those venues and where you see, advising on the use of those new funds? Where does that fit best, and how might our committee engage with that?
Well, as you can imagine, with public funds, we have an advisory committee for every public fund we have. And they all do their work to make sure that we're following the vision and the direction of the fund. So one of my recommendations is that maybe we should take some time to bring together to this committee in some kind of a graphic that probably we could share with the entire task force. Here are all the different funding sources from the governments and what they're currently doing and how they intersect, at least for the county, but you know, we meet with the city every single week on these issues. And it's mostly for housing, but obviously, you know, behavioral health support to make sure people can stay in housing is a critical component. So we work with the city as well, but I think it would be helpful to figure out how to draw a roadmap that is going to be simple enough for all of us to understand. I mean, those of us who are in the thick of it day to day don't think of it like that, right? But in order for us to orient people to all the funding sources, how we purposefully intersect them and blend them to create new programs that's just what we do day in and day out. And maybe a roadmap would be really helpful, because maybe also with that single roadmap, if we can find some artist smart enough to do that, would also help us identify maybe gaps or areas where we'd like to focus, you know, our efforts, where something might not be at the top of one of those committees' lists, for instance. Because, you know, from a county point of view, and Dan mentioned the PETA continuum, but we do put a significant amount of our behavioral health funds into early intervention prevention services, as well as intervention, and a lot of support for criminal justice diversion, as well as housing for people with behavioral health disorders. So we really try to balance the continuum, but again, it's a finite source of funding. And I think as we bring on new funding sources that Dan just talked about, some of the new taxes, I think that's the time when you always want to look at what you have from a comprehensive picture to see where are we missing something and what is possible. So I know we do an annual report for the Behavioral Health Advisory Committee that shows how the fund was used. We have a complex picture for our housing dollars. And I know the city has done similar things, and maybe we could just bring to this group the current state of affairs, and then that might be helpful in terms of launching discussions about where to go from there.
I'm seeing about 8 nods. So I think everybody in the group, Ann, is thinking that that would be helpful. And I had this brief picture of I don't know who the artist was that you brought in to do Grace. You remember that Grace roadmap? Anyways, that stuck in my head. And so I think sometimes the visual depiction can be really useful. And it could be helpful for this group, one, to get an understanding, two, to understand maybe where levers and input is really valuable, useful, and maybe necessary. That's really helpful.
So, and of course, we brought in that graphic illustrator specifically for that purpose, right? Is that we wanted everybody to see the same thing. I volunteered to make placemats for everyone. Nobody took me up on it, but I had a laminating machine and I was gonna do that. But it might be something we think about here for this group as well, or even the task force generally. There has been a lot accomplished, and it's easy for the general public to look at what hasn't been accomplished yet, right? Forgetting all that has been. And so part of that goes back to our discussion, Dan, of the communication efforts, but I can certainly work with Dan and Mike on gathering an inventory of what we have in some communicable way.
That would be extremely helpful. You know, as Dan mentioned, a bit of news with the Blake decision, which is far reaching and it's going to have lots of impacts. And so that's some are seeing as very challenging. Some might see as liberating. Regardless of how you look at it, it's going to need work to figure out what to do, and it's going to need funds. And then the second piece of news I think that's hitting us, and why that roadmap could be so useful right now, is there are new funds available that have not really even been fully digested. I don't even fully understand what's in that giant $1.9 trillion package. And I think that some of it will probably be really good and broadly applicable and useful, and other things are going to have lots of rules and challenging aspects to them. And that's been my impression anyways of federal funds in the past. And anyways, understanding what we have now and maybe where our gaps are might really prime us well to understand and to best use new resources. We didn't even get into that in this agenda. It's so brand new, it couldn't make it into the agenda. But I really appreciate, Ann, your perspective on getting us squared on what is.
You know, the other thing I might add, just when you talked about the new money, there is significant new federal block grant dollars coming to us, to our region. And one of the top priorities is to expand our outreach teams with that. So obviously that's something we've talked about a lot in the incarceration task force.
Yeah, that's outstanding news. So I think, Dan, on this one, we've got kind of a list of priorities. I'm wondering, Dan, if you think we might do something similar. What I was going to do with Gare was kind of sum up what we've got and be able to send that off to Index and then share that summary. How would it be, Dan, if we put together kind of a summary and whatever else committee members send us, and in terms of ranking and using Stephen's cauldron idea, we're kind of taking off on one on the funding piece. Maybe we could put the other things out and have the committee interact with that and rank it.
Yeah, I think that's fine. I was just listening to what Ann was saying, and I think that yes to your idea, and then I think that yes to Ann's idea of having like a basic synopsis of what I would refer to as the is and is not category of stuff that we can deal with, and then we can move into the should category after we have an assessment and an inventory of what we have in this community. And I think that we've got a number of new folks on the committee. I think it would just be super helpful for everyone to get up to speed, and for those of us that have been here for a little bit, it's a good reminder, as to what we have. So I think that's I'll commit to working with Ann Deacon. I think I've volunteered for multiple projects with her on communication stuff, so I'll just add this to the list, I guess. So yeah, I'm happy to do it.
Great. Okay, Stephen.
I just want to note that the conversation we've just had, looking forward to priorities for the subcommittee, is exactly what we'd like to see on the subcommittee portion of the annual report as well. Start to frame out what the coming year might look like. A year from now, we'll come back and we'll report to the county council on progress that we made. So I think we've done two things here. Is we've set out some real possibilities and ideas and avenues to explore. And whoever's writing this, Dan or Mike or some combination, you have a framework, I think, to lay out at least part of the subcommittee's section of that annual report.
Thanks for that, Stephen. It's always nice to have two birds with one stone when you're not even sure of it. That's super. Dan, our last agenda item, and I do see, actually it's not the last one, but did you have anything more on the state legislation? I know you talked to us briefly about 1590, but before we go on, I just wanted to check in with you briefly.
We have over 20 bills that the city's looking at, monitoring. A number of those are on police reforms, public safety. And so what I'd like to do is to table that and move it to the next meeting for this committee. I want to see what gets out of committee and is actually going to have legs in terms of potentially being something that we're going to contend with. So I'd move that we table that into the next meeting, and I'll bring back a summary of what the city's looking at, and I'll try to work with my county partners to see what they're looking at as well.
Sounds really good. Thank you. Okay. Next up in the agenda, we're on number 6, is identify connector points in the system and facilitate strong, warm handoff process. Dan, we didn't have anybody buy that one.
Oh, I thought that was you on that
That was
one.
me. Oh, boy.
Maybe that's part of the discussion we just had about bringing together the information of what we do have, where the connection points are, and then that will help us determine where they aren't.
I like that.
I think some of that was born out of, there were a number of different component parts to this. I think one was what happens to people when they exit a system like jail.
Mhm.
What happens to them? Do they have a warm handoff to a person that's helping them transition back into housing or their job? And then the others, this is all from memory, I apologize. The other pieces were, we have an emerging 911 responding program that's going to be potentially unarmed. What happens to folks after the triaging component of that stops happening? So what happens when the nurse and the DCR, they go away? Well, what happens to that person? Is there a handoff to lead or to grace or to something? What does that look like? We don't want to leave anyone behind. We want to make sure that people have the care continuum that's appropriate for what they're going through. And so that's, those are the component parts. And I think I saw Mike just chime in with his camera. Maybe he's got ideas as well. Hilly.
Well, yeah, thanks, Councilmember Hamel. A couple of gaps there, and of course we see them every now and then, at least from the EMS perspective. And this morning, reviewing a case coming out of the detox center where a patient, showed up the door, wanted help. Of course, it needed a medical clearance, sent over to the ED, waited in the waiting room X amount of time, got pretty jumpy and left. Of course, went back to drinking, wrecked a car, ended up in jail. With a medical clearance, did okay for a few hours in jail, but got sick again, went back to the ED and realized the patient had a spleen injury. And I guess in that particular case, so you kind of think about, well, where could that have been prevented? And this has been kind of an issue, where people are trying to get in the door there, but they don't get a warm handoff or sent to go, for example, in this case, get a medical clearance, and somehow are supposed to do that on their own. And that's happened in other areas of care as well, where, somebody, for example, went to the jail and then had to be sent to the ED for whatever reason. And of course, they're not really monitored, et cetera, over there. So that's just one example of one of those gaps of having those warm handoffs and those very behavioral health, issues. So, and mental health the same way. So anyway, that was just one of the known gaps from an EMS perspective. And I've got more stories, but yeah, some way to, a patient reaches out, they're asking for help, they show up at the door, but then they're left to navigate on their own. So how can we help with that?
This is a job that needs to exist but doesn't exist. So to me, this is the job of what I call the navigator, but you can call it anything that you like. It could be a peer counselor, but it's somebody that assists stability for the people who are engaged in all of our systems. And it's sort of nervy to say we need a new task job person here, but I just hope you'll think about this, that it is one of the large gaps in our system, that there isn't a person or people to carry people through and not have them drop into the gap of returning around and doing the same dance and the same merry-go-round, So the conversation today has been more outside the box than I've seen in the past. And so I'm just suggesting that we need another job here.
Arlene, as I heard you talk and I heard Mike's story, I thought, well, if the person was homeless and it was during the week with the outreach team, that's an ideal thing for an outreach team member to show up. Mike, I also think of like community paramedics. If that person was on the radar, it could be. What if they don't meet those though that population characteristic? What if they don't meet that need? We don't really have anybody, do we, for that type of a transition and that handoff?
No, I mean, it's just, we have to invent what we don't have. And I'm sure we're not the first program to think about this problem. So some of the solutions already exist in other cities. So it could be researched, but just the simplest way to say it is that this is somebody who follows along with the individual, whatever their need is, whether it's an appointment, housing, counseling services, getting to an AA meeting, they're just there.
So back, Mike, if I want to chime in real quick here. So back in the day, I'm one of the co-founders of Project Homeless Connect. Some of you folks might recognize that event. So it's a one day out of the year, we provide 50 different types of services for people experiencing homelessness. Very popular with folks, really good way to connect people in the community with the issue of homelessness. And we had talked about, well, what about the other 364 days a year when we're not doing this? You know, it's like people still need help, you know? And so we had talked about doing a Project Homeless Connect every day and what that program would look like. And Arlene, is exactly what you're talking about. It's about people helping people navigate systems, the complexities of systems that don't often talk to one another, are siloed, and are challenging for folks, and especially for folks in trauma or just in hard times. And so how do we do that? What I want to do, though, I want to make sure that we are contained within our subcommittee's group's charge, and that is incarceration prevention and reduction through the behavioral health lens. So when we talk about this, I think that we do need to bring this navigation piece forward. I think it's a very appropriate discussion for us to have, but I want to make sure that we're doing it within preventing people from going to jail and helping them stay out of jail and be healthy people.
I mean, there are people who are actually doing these tasks as volunteers. Some of you may know about, Restorative Community Coalition. So the people in that organization volunteer to assist people who are in jail and about to leave and need jobs and housing and so forth. And they do this unpaid. They should be paid, and they should be hired by our county because they're setting a model for what needs to be done. But they are navigating. They're going into the courts with the individual when they have to show up for court. It's so intimidating to be in court if you have no experience with legal matters. So these navigators, these helpers, are reducing the anxiety of the person who is getting faced with crucial life decisions. Do you want to do this, or do you want to do this, or do you want to make this plea or not? And they have no experience with it. And so those navigators are actually doing those jobs. So here and there, we do have some of this going on, but it's not official. It's not sponsored by the county and so forth. They've been talking about this for a long time.
Thank you for that, Arlene. And in the interest of time, we only have a few minutes left, and I do want to save a little bit of time for public comment in case there is any. And I just wondered, with Mike Haley and Ann Deacon on the phone, Mike, in a fully functioning crisis stabilization, would that center, would that building and all of its wonderful people in it, would it have helped in your situation? Or it's kind of a naive question, but I wondered if maybe that person had been brought there for medical clearance, for detoxing. Would there have been some of those supports you were seeking? Or is it more like Arlene's talking about, there's really just a black hole for that help that you were seeking for that person?
Yeah, thanks, Mike. It's a little of both. And so a lot of it is around transportation more than anything. So when somebody shows up, they've got a full building. They don't really have the ability legally and probably capacity wise to put that person in a rig and take them to a facility. and wait for them until the facility decides to get to them. And sometimes, that could be 2, 3, 4 hours where you'd have to have somebody sitting with that patient to make sure they actually get into the inside of the ED in this particular case. So yeah, I think it would have kept that person out of jail, and it probably would have prevented that spleen injury because, once again, they were sitting in the ED waiting room, off gas in their chemicals and getting pretty agitated about it. And one other area that pops up, and this has come up several times in our community medic teams, is that once they find a person to engage, the inpatient facility may not be in town. So they might have to drive them to Fairfax or sometimes down to Centralia. And I know that, they've kind of done that in a haphazard sort of way if they could get somebody to do that for them and actually spend that full day. I mean, that's a 10-hour day if you got to go down to Centralia and back with a patient, and then plus advocate to get them in there. And then even in some of those cases, once they got down to the facility, they were turned away. I know that there were several cases where patients were sent by their own means to a receiving facility that only get there and then be refused entrance into the facility. So that warm handoff and that constant communications, I think, is imperative to make those successful. And then one thing I do want to let the group know is we just started this week, and actually hopefully to solve a small part of this program locally, is that sort of under the COVID idea, I have a van that we put into operation. It's a 12-person van. We took the seats out of it and created barriers for COVID patients, and ideally it's for transporting COVID patients and navigating them to the proper places, mainly out of base camp. And so what I'm hoping is that we might demonstrate a little bit of a program here that could go into a permanent status that would allow these drivers, which right now happen to be EMTs, which I thought was really good because they can handle emergency. They're good with dealing with patients. They know this patient type. And in the last week, we've had 2 transports out of base camp where one of them was actually navigated from base camp over to the crisis stabilization facility with a warm handoff, and actually even was able to make a stop and take care of some personal issues for that patient before they checked into the crisis stabilization facility. And for the CSC, one thing we have set up is if a patient now appears at the front desk and they get that COVID test and they're positive, they can call this driver for the pickup to take them over to the hospital and do a warm handoff. Now they can't stay with the patient, but they can do a warm handoff and make sure they get to the counter. So I'm hoping to see how this works. It's a 6-month project funded under CARES. It's running from noon to 6 every day, but I really think we can demonstrate some of these good things that could happen to patients if we had somebody that just was able to do that on a day-to-day basis. And I know the community paramedic program, the GRACE program, has been really looking forward to this because that's been the #1 thing, is just transportation, getting them around. So yeah.
Mike, thank you for sharing that. This might be a thread that we'll pick back up. It may tap into your knowledge and of both the issue and possible solutions, but thank you for sharing that. I apologize, guys. I am a bit over time. Jill, without further ado, do we have any folks that would like to make public comment?
We have 3 attendees to the meeting today. If any of you would like to speak to the committee, please virtually raise your hand at this time. No hands are raised.
All right. Well, thank you all for your attendance. I'm sorry I'm a couple minutes late. It was a robust conversation, this meeting. Thank you all, and we'll be in touch with agenda items and our follow-up from today.